Brothers Subhi and Hilmi Qureshi were working on their PhDs in Moscow in 1998 when their father, legendary Tele-University political science professor Zahir Masood Qureshi, passed away, and they decided to return to India.
Our father, he was a social scientist, and he had always taught us that we should give back to society with our core skills. And the skills that we had, whatever little we had, was around science and technology, a little bit of communication technology and applied maths.
What emerged was a social enterprise called ZMQ, whose core philosophy has been technology for development. Over the years, the organization has used games and smart messaging to create positive behavior change and establish appropriate health practices. And implementing these solutions at scale has ensured that over a period of time, existing systems, some of which are flawed, change. For instance, one of ZMQ's active programs is Freedom TB, or the Tuberculosis Active Compliance System, which challenges the World Health Organization's DOTS, or Direct Observation Treatment strategy.
Direct observation is top-down model of observation. So there's somebody sitting on top who will observe your behavior of treatment. So in the environment of today's connectivity, we thought that this is a redundant approach. The new approach should be active compliance. People should be active in their reporting. We have to build an environment for active. You have to first go to the ground and tell them, we want to teach you TB, and how should we teach you TB? So we sit with them and tell them what is TB, and then design with them, along with them. So we conduct game labs, we conduct design labs with them to start building those programs. We are not bringing an app into an existing process that's running. We are actually redesigning the whole process of delivery of health, whole process of delivery of education, and it is we are not enabling the dots. We are challenging the dots and bringing a new system in place.
In this village near Nuh, in one of the country's most backward districts, Mewat in Haryana, the confluence of smartphones, leveraging existing government infrastructure and building a dedicated on-ground workforce has meant patients both young and old are using the active compliance system to monitor and treat themselves.
ऐसा अलार्म बजेगा आपको जैसे आज दवाई लेनी होगी।
मैंने जब अपना ट्रीटमेंट चालू किया था गवर्नमेंट हॉस्पिटल से, तो वहाँ के डॉक्टरों ने मुझे एक फ़ोन दिया जो मुझे ये मैसेज करता है डेली, जब भी दवाई का डे होता है, कि मुझे अब आज अपनी दवाई लेनी है, और क्या कहते हैं अलार्म होता है, एंड इसमें एक मैसेज भी आता है जिससे कि हमें हिम्मत रखनी चाहिए, हारना नहीं चाहिए.
In terms of government, we don't use government finances or resources. We just use the expanse of the government. We use the infrastructure of the government, which might not be as effective, but we put technology in that and use the infrastructure which helps us as well as the government to scale the program together.
In 3 years, these awareness-generating games on tuberculosis have been downloaded over 2.6 million times in several languages. Apart from tuberculosis, ZMQ manages similar programs for HIV/AIDS and polio, and its core work extends to sexual harassment, literacy, skills development, and maternal and child health. Launched in 2012, ZMQ's Meera is an integrated mobile phone channel to provide information on prenatal care, child immunization, newborn care and family planning to rural women via interactive edutainment tools and on-ground support through a network of Meera workers. The United Nations has recognized Meera as an ideal strategy to improve maternal and infant mortality rates in the developing world.
Being from the technology background, we have inbuilt technology tools within a program which can say, which can calculate what has been the behavior change of the communities over last 2 years, what has been the impact.
Today, there are more than 100 companies and foundations across the US, Europe, Africa and Asia who use ZMQ's model as a tool for sustainable behavior change, and Freedom TB and Meera programs are now being implemented in partnership with the governments of Afghanistan and several African nations. But ZMQ is today poised to embark on its most ambitious program yet, the Personal Connected Health Platform using Internet of Things and its Mobile for All program.